Chapter 23, Newborn Feeding. The full-term infant needs an average of 85 to 100 kcal per kilogram if breastfed and 100 to 110 kcal per kilogram if formula fed. Breast milk and regular formula are 20 kcal per ounce. Many newborns can lose up to 10% of their birth weight in the first few days of life. It can take up to 2 weeks to regain that lost weight. The nutrients that are needed for newborns are carbohydrates, proteins, and fat, and they are found in both breast milk and formula. The infant gets the fluids it needs from breast milk or formula, so no further water is needed. Too much water can cause electrolyte imbalances, and they can lose the nutrients in the breast milk or formula if they are having water instead. Breast milk provides protection against infection and is easily digested. The composition of breast milk changes in 3 phases of lactogenesis. Lactogenesis 1 begins during pregnancy and continues during the first few days after birth. This is when the breasts secrete colostrum, which is a thick yellow substance. It's higher in protein and some vitamins than the mature milk. It's also high in immunoglobulins, which protect the GI tract from infection and helps when passing of meconium. Next comes lactogenesis 2, which begins with about day 2 to 3 after birth. The colostrum will change to transitional milk over 10 days. The immunoglobulins and proteins decrease, and lactose, fat, and calories will increase. After the transitional milk, the composition changes to lactogenesis 3, which is the mature breast milk. The milk has a bluish color, and it's not as thick as before. Breast milk does contain enzymes that help with digestion. Amylase is necessary to digest carbohydrates and is low in infants, but breast milk does contain this, so it helps with that digestion process. Lipase is also present and helps with digestion as well. Breast milk does contain immunoglobulins, which help fight off infection. Secretory IgA is also produced in the breast milk and helps fight off viral and bacterial infections of the intestinal mucosa. Infants who are breastfed have a decreased incidence of respiratory, GI, UTIs, otitis media, asthma, diabetes, necrotizing enterocolitis, some cancers, obesity, sudden infant death syndrome, and infant mortality. Unmodified cow's milk is not recommended in infants until 12 months of age due to its containing too much protein, potassium, chloride, and sodium. It also lacks sufficient fatty acids, iron, and vitamin E. It can also cause GI bleeding and anemia. Modified cow's milk is the source of most commercially prepared formulas. The manufacturers make the necessary changes so it's safe for infants. Vitamins and other nutrients are added to make it close to breast milk. Formula should have iron added to it, and iron-enriched formulas should be used for infants. There are various formulas on the market for infants with special needs. This can be lactose-free or soy-based. These formulas are much more expensive, and if the family receives WIC, they need a prescription from the provider so they can get that with their allotted formula through WIC. Choosing a feeding method is a decision a woman needs to make. Many times they may turn to us for input and education. The most important thing we can do is provide the education and support her decision. There's a lot of research out there showing the benefits of breastfeeding and how it's the best for infants, but we need to remember that the most important thing for that infant is that it's getting fed. If a woman is not comfortable breastfeeding, then that infant may not be getting fed enough. We want to be sure we are supporting her decision so the infant is fed and receiving proper nutrition. The benefits for both mom and infant are listed in box 23.2, so please review. The disadvantages are basically going to be the opposite of the advantages. One of the reasons women don't want to breastfeed is they feel their significant other doesn't get that bonding time with feeding. Educating on other ways to bond, including bath time, rocking, playing, etc., can help with that. Some women will choose to do both breastfeeding and bottle feeding. Bottles can contain pumped breast milk or formula. Many times this is a good way for both parents to be involved in feeding. There are many factors that can influence a woman's choice to breastfeed or not breastfeed. One is support from others. Breastfeeding is not always easy during the first few weeks of life, so without support, many women will either not breastfeed or quit soon after being discharged from the hospital. Another factor is their culture. Many cultures like Muslims, Asian, Pacific Islanders, or Hispanic have high rates of breastfeeding. Some cultures do not even have formula in the hospital setting, so they have no option but to breastfeed. Another factor is how soon the woman is planning on returning to work or school. Many times a workplace may not have an appropriate place for the woman to pump or adequate places for storage of the breast milk. Another factor is from the staff at the hospital may not be supportive or educated on breastfeeding. Many hospitals do not have lactation consultants anymore, so it's up to the staff nurses to provide the education to mom. Look for community resources as far as breastfeeding classes, lactation consultants, or breastfeeding mentors who can help mom once she's released from the hospital. Breast changes begin early in pregnancy due to the hormonal changes that occur during this period. The breast will enlarge due to the hormonal changes and the preparation for the possibility of breastfeeding. Production of colostrum is present at about 12 to 16 weeks. Milk production is a complex process. A small amount of milk will be in the breast at the beginning of a feeding, but most is made once the infant starts suckling. It's a supply and demand process. If mom is going to formula feed, the breast will not make any more milk. The milk production ceases due to no suckling at the breast. We teach women if they are not breastfeeding to not stimulate the breast. They will have an initial milk supply due to the hormonal changes, but once the breasts are not stimulated, the production will stop. At birth, the hormone prolactin is increased and will stimulate that milk production. Suckling at the breast will keep those levels high. The levels will be high if mom is pumping instead of putting the infant to breast as well. An increase in nipple stimulation will cause an increase in the hormone oxytocin, and this will cause the milk ejection reflex, also known as a letdown reflex, which allows the milk to be released from the alveoli to the ducts. And an increase in oxytocin can occur when a woman thinks about her baby, hears a baby cry, or sees a baby and can cause the mom to leak milk. Educating on wearing breast pads inside her bra can help absorb the milk if this happens. The release of oxytocin can also cause uterine contractions or cramping at the start of feeding as well. This pain is referred to many times as after pains. Typically, the more children the woman has had, the more intense these pains can be. Little preparation is needed during pregnancy for breastfeeding. Women are instructed to avoid soap to the nipples during pregnancy, as this can remove the natural protective oils of the breast. During pregnancy, nipple assessment should occur to determine the type of nipples she has. They are classified as everted, which are best for breastfeeding, flat, inverted, or retracted. Your book has good pictures of each of those, so please look at them. Some research suggests breast shells for flat or inverted nipples. There are breast shields that are soft silicone-like material that fit over the breast during feeding to help the infant to be able to latch more effectively. Education is a big part of OB nursing. Many women are discharged 24 hours after delivery, so we must educate on the complications that could occur with breastfeeding before they go home. There's a safety alert box in your book with infant signs of breastfeeding problems. We can assess for any of these concerns before discharge and let parents know how to watch for these as well once they go home. If these issues should arise, they should contact a lactation consultant or breastfeeding specialist. Many times they may call back to the OB department and the nurses may help as well. One of the biggest concerns is a sleepy infant. A few ways to wake a sleepy infant is to unbundle any blankets the infant may be wrapped in. They like to sleep in that warm environment. Changing a diaper, even if it's not wet or dry, can also wake an infant. Stroking the cheek to get a rooting reflex can help as well. If the infant falls asleep quickly after starting a feeding, stroking the cheek may help. Stroking the bottom of the infant's foot or running your finger up and down over the spine may wake the infant as well. Nipple confusion can occur if the infant has been introduced to a bottle or pacifier. The infant uses different sucking mechanisms at the breast than they do with a bottle, nipple, or a pacifier. Breastfeeding requires more of a vigorous suck, so many infants do not get that immediate satisfaction they get with an artificial nipple. Education on trying to avoid the use of other nipples until good breastfeeding is obtained can help with this concern. Difficulty in latching can be a big problem for infants. Many times the infant doesn't open its mouth wide enough, so they're only sucking on the nipple. The nipple and areola need to be in the infant's mouth to enhance milk production. Putting a gloved finger on and assessing the suck reflex can help determine if the suck reflex is strong. Also, by doing this, you can feel what the tongue is doing during the sucking process. Many times the tongue curls up and it's not remaining at the top of the oral cavity. Also, eliciting the rooting reflex can help the infant open their mouth wider to ensure proper nipple placement as well. Other problems that can cause concern for the infant is if the infant is displaying signs of jaundice. Remember, we talked about the buildup of bilirubin is a cause for jaundice, and the bilirubin needs to be excreted to prevent jaundice. The way it's excreted is by frequent feedings. If a mom is struggling with breastfeeding, she may be worried the infant isn't getting enough by breastfeeding and wants to stop breastfeeding or supplement with formula. Providing assistance and proper latching can help with this. Prematurity is another issue that can be of concern. Sometimes they have other issues going on and are not able to eat. Mom would be encouraged to pump and store the breast milk for later feedings. Many times, depending on how premature the infant is, they may not have a strong suck reflex or an absent suck reflex. In these situations, the use of lactation consultant or specialist is very helpful. Once again, mom's encouraged to pump. Many times these infants can be fed via NG or OG tube, via syringe, or even put on a soft toothette and rubbed on the infant's gums. There are also concerns related to mom. There's a safety alert box in your book on maternal signs of breastfeeding problems. Engorgement is a temporary problem when the breasts swell or become full for a few days after birth when her milk starts to come in. This should not stop breastfeeding, but sometimes it makes it harder for the infant to latch on. Having mom put cabbage leaves in the fridge to get cold and then putting the leaves in her bra can help with that discomfort. Wearing a good supportive bra 24/7 can also help. It can also lead to mastitis, which is an infection in the breast, so we talk about that more in upcoming weeks. Nipple pain is a common concern for women. Providing them with a cream such as lanolin can help ease with that discomfort. Assessing to be sure there are not any cracks or bruising of the nipples is important. This can occur from an improper latch. Most nipple pain will subside within the first few weeks of life. Most times when mom is sick, she does not need to stop breastfeeding. In the incidents in which she does need to stop, she needs to pump to keep her breast supply where it needs to be. Some medications, both prescription and over-the-counter, may enter breast milk and not be safe. Educate all breastfeeding moms to check with the provider or pharmacist before taking medications. There are a few maternal conditions where breastfeeding is contraindicated, and these include being treated for TB, HIV, maternal chemotherapy, and when moms need to take medications that are not safe for the infant. If a woman has had previous breast surgery for augmentation or reduction, breastfeeding may be more difficult for some women while others do not have any problems. With these conditions, referral to a lactation consultant. We talked earlier about how going back to work can make it hard for the breastfeeding mom. She would need to pump 2 to 3 times a day to keep her milk supply where it needs to be, depending upon how many hours she is gone. Breastfeeding with twins or more is possible. It's important she's breastfeeding every 2 to 3 hours to help build her milk supply. Sometimes she may need to supplement with formula or want to have someone else give the infant a bottle to give her time to rest. Please refer to the patient-centered teaching for solutions to common breastfeeding problems in your book.